I have a real pleasure to talk with Professor Thor Edvardsen, the president-elect of the EACVI. Professor Edvardsen, first of all, welcome to Belgrade and thank you for agreeing to answer a few quick questions.
Thank you so much, and thank you for your hospitality here in Belgrade.
If you don't mind, I will start with the first question. Mechanical dispersion is one of your main research topics. Do you think that dispersion will become a guideline proposed selection criterion for ICD implantation?
It might well happen, but before we can sort of give advice to do mechanical dispersion and then give an ICD, we need to do a prospective study. So we need to do a randomized study, not blinded of course, that's not impossible, but we need to do a randomized study, use the mechanical dispersion in patients, and then say half of them will have an ICD, half of them will not have an ICD. And after we made up these answers, if they will benefit of having an ICD, then we can advise it in the guidelines. I do believe, however, that mechanical dispersion is very important, but for the moment we cannot advise them really to use it as an only source of having ICD.
What do you consider the most important novelty in echocardiography over the last 10 years?
I have these questions many times.
Really?
Many times. And all people are expecting me to say speckle tracking echocardiography. But that's not the truth.
Really?
I think the most important advantage is the improved image quality. So if companies ask me what they should put into like fancy stuff in the echo machines, I always answer them, please make the imaging quality even better. Because if the image quality steadily improves, then we can do lots of funny things, softwares, and put into the scanners, even speckle tracking. So I think image quality, that's the most important advantage.
What is your advice for cardiologists who have just started their professional career?
I think in terms of what they want to be, like invasive or imager, or I think imaging will, I think in all kind of medical areas, imaging is steadily being more and more important. So I think it's a bright future for those who choose imaging as a sort of future. And another advice will be to never give up. If you really are interested in, for example, invasive cardiology, then you should do all that you can to become one. Because we need very dedicated people in all kinds, in electrophysiology, in imaging, in invasive stuff. So if you're really interested, then you should go for it.
And what is the best advice that you have ever got?
For myself, it was to start with research. Because I was a clinical guy and I thought I love patients, so I thought that I will stick to patients for the rest of my life and never do research. But after starting research, I realized that you can even help more patients. If you are doing good research, excellent research, then it will be beneficial also for the patient. So that was my best advice, to start research.
Thank you very much, Professor, for your time.
Thank you.